Most people who find out they have HPV never had symptoms. No warts, no pain, nothing that felt off. So how did they know? Through screening. In this episode, we're talking about how HPV is diagnosed, what tests are used, and what the results mean. If you've ever wondered what a Pap smear or HPV test actually checks for, this video is for you. In women, HPV is usually detected during routine cervical screening, also known as a Pap smear or HPV test. Here's how it works. A doctor uses a small brush to gently collect cells from your cervix. These cells are tested in one of two ways. Pap smear looks for abnormal or precancerous changes in cervical cells. HPV DNA test detects high-risk strains of HPV even before any damage is visible. In the UK, this screening starts at age 25 and happens every 3 to 5 years, depending on your age and past results. In the US, it's usually recommended from age 21, with co-testing or HPV-only testing from 30 plus. Now here's the tricky part. There's no approved routine screening for HPV in men. That's because most HPV infections in men go away on their own. There's no cervix to swab. And HPV-related cancers in men are harder to screen for without symptoms. So how is it diagnosed? Usually through symptoms like genital warts or throat issues that prompt testing. For high-risk groups, like men who have sex with men or those with HIV, anal pap tests or oral swabs may be recommended, but these aren't part of routine care. Yet, if your test comes back positive for HPV, here's what that can mean. Low-risk HPV positive. You may have genital warts, but there's no cancer risk. High-risk HPV positive with normal cells. Your doctor will usually monitor with repeat testing in 12 months. High-risk HPV plus abnormal Pap. This may lead to a colposcopy, a closer examination of the cervix using a magnifying tool. Persistent infection. You may need a biopsy to examine the cells more closely. Testing positive doesn't mean you have cancer. It means your doctor is watching your cells carefully, and that's a good thing. Depending on your results, your next steps could include repeat testing in 12 months, a colposcopy, LEP or biopsy for more advanced changes, or simply routine monitoring if your body clears the virus. Your doctor will guide the process. What matters most is staying consistent with follow-up appointments. That's how screening saves lives, by catching problems early. HPV can be seen or felt in most cases, which is why diagnosis through screening is everything. In our next episode, we'll talk about what happens after you test positive. So if this video helped you understand the screening process, leave a comment, hit like, and make sure you're subscribed. You deserve to know what's happening in your body and how to protect it.